Chief guest of today's session, Professor V.R. Shinde, guest of honor and chairperson of today's session, Professor Surendra Kumar Sia from Pondicherry University. Special invitee, Dr. M.V.N. Venkatrao, President WCOP of Andhra Pradesh. Special invitee and the trainer of today's session, Dr. Pankaj Singh. WCOP President Professor B.G. Reddy, General Secretary Professor R. Subhashini, Treasurer Professor V. Suresh, and Coordinator Dr. Ashok, Executive Committee members, Core Committee members, and participants of today's session. A hearty welcome to you all on this pleasant evening. Now I request our President, Professor B.G. Reddy, to give his presidential address.
Good evening, everybody. I am happy to announce that World Congress of Psychologists 3 months certificate course, that is training program on school counseling. We are running, as you all know that, but today happened to be the 7th session. Now, I am welcoming wholeheartedly today's VIPs. Surendra Kumar Sia from Pondicherry University is a guest of honor as well as chairperson of today's session. Then Professor V.R. Shinde from Savitribai Phule, Pune University, Pune, is as chief guest. And wholeheartedly, I also welcome another VIP, Dr. Pankaj Singh, special invitee as well as trainer of today's session. He is from Noida, Uttar Pradesh. And our Dr. M.V.N. Venkatrao, World Congress of Psychologists President and special invitee. And I also welcome the chief patrons, and secretary, treasurer, and core committee members, executive committee members, and the program coordinator, Professor Ashok. Then the repertoire of this program, Dr. Chinni Simon, executive committee member, Dr. Venu, and other beloved participants. Once again, I welcome you all. Now, again, I request Dr. Chinni Simon to go ahead.
Thank you, sir. I request our guest of honor and chairperson of today's session, Professor Surendra Kumar Sia from Pondicherry University, to address the gathering. Professor Surendra Kumar had taken his PhD from the University of Delhi. He was a recipient of Junior Research Fellowship of UGC in both MPhil and PhD programs. He completed a minor project by UGC and a major project by Rajiv Gandhi National Institute of Youth Development, and is now working on a major project by Indian Council of Social Science Research. He guided 9 scholars and 8 more on hand at present, and published 44 publications in various journals at national and international repute. More than 25 years of experience as project associate, research associate, and lecturer. At present, he is working as professor in Pondicherry University. Very happy to have you, sir, in our midst this evening. I request you now to address the gathering.
Thank you, ma'am. Thank you for the introduction. Good evening to everybody. Respected Reddy sir, and I also my regards to Singh sir, Dr. Pankaj Singh, and other senior members, Suresh sir, Mishra sir, Girishar Mishra sir, Ganeshan sir. I show to all of them. Without consuming much time, I would like to share a few words about counseling as a professional service in the school context. All of us know that when we talk about, means if we take counseling and its relevance in the context of school, three things come to my mind. One is the student, the other one is teacher, and the third one definitely it is also equally important is parents. So I think these three, it is not that if the counseling is oriented for students or children, that will be effective, or if it is only for teachers, that will be effective, or if it is for parents. I think attention can be given to all the three components. Then going one step ahead, usually what happens when we say any professional service, whether it is counseling, therapy, intervention, one thing, the thing that comes to our mind that it is meant for individuals or children or students who are having some difficulties, abnormalities, or some deficiencies. That is true, that is required. But again, I mentioned, I think three components are equally important. One is, like other services, counseling can be oriented for taking care of the deficiencies, fine. Those who are having some difficulties, maybe learning disabilities, whatever the difficulties, deficiencies, counseling can be directed to take care of that thing. That means overcoming that deficiency and bringing back the individual or student to the ground zero neutral level. And again, after that, what happens? Those who are at neutral level, normal level, just like we maintain our body, maintain our health, we need energy, we take carbohydrates, we maintain our body. After that, we remain at a neutral stage, then we try to improve. So we may take some vitamins, we may take some health drinks, we may take some fruits, dry fruits, whatever we can say, that can enhance our health. Similarly, counseling can also be equally important, those who are at the normal level, to enhance their capability from the existing level. Now, another question comes, suppose there is a student who is very good, securing 99% of mark or 100%. Nowadays, they are also performing like that. Whether counseling can be of use for them or not. To me, what I feel, it is also required. Because what I I'm sorry. I think I was not audible.
Yeah, you are audible, sir.
Yes,
now
you
it
are
was
audible.
muted. Okay, so what happens? We may feel that those who are good students, bright students, counseling or therapy or intervention may not be required. But what I feel, it is required. What happens? Any behavioral attribute, it may not be permanent. Suppose my son is securing 90% today. I don't know, he may secure 80% in the next exam. So if somebody is performing well, if somebody is in a very good state of mind, it is also equally a challenge for the psychologist or the counselor, how it needs to be maintained by the student. So what I feel, counseling can be equally applicable for all these three categories. Students having deficiencies, students who are at the neutral level, students who are performing well. That is why all of us know there is a lot of focus right now upon positive psychology. So coming again to another, I will not take much time. One more thing I would like to share. When we discuss about counseling, again, three things come to my mind. One is guidance, counseling, and of course, this education. Education is being provided by our teachers in schools or classrooms, that is being provided. Guidance, all of us know, I think means all of you must be knowing. I'm just trying to refurbish it. Time to time, students also need additional information that can also be provided. And more important, I think, counseling, which is going to be for our participants, which is going to be provided by our trainer, by our expert. So without consuming much time, I invite our trainer and to proceed further. Thank you very much. So,
Thank you very much, sir, for telling us about the importance of counseling in the school level. Now, I request our chief guest, Professor V.R. Shinde, to give his to address the gathering. This evening, Professor Vishwanath R. Shinde has taken his PhD from North Maharashtra University, Jalgaon. He is working now as a professor in Savitribai Phule Pune University. He has won Indira Gandhi Gold Medal Award and had written many books and published 54 research papers and 14 articles in various magazines at national and international reputation. He attended so many refresher courses and worked as resource person and chaired so many sessions in several national and international conferences, seminars, and workshops. He guided 16 MPhil and 8 PhD students and has lifetime membership in various associations. We are very happy to have you, sir, with us today. I request you to address the gathering now.
Thank you very much, ma'am. The 3 months training program on school counseling is the theme which is organized by World Congress of Psychologists, a very good theme for us, for the psychologists. And in this connection, I'm very grateful to the President, Dr. V.G. Reddy, who have invited me to speak on this occasion. Now, the motto of this program is, train yourself and train others. Particularly with respect to counseling, we must know something about counseling. Not only we must know about the counseling, but the training is essential. For that purpose, certain skills are important that is to be obtained. So in spite of not only the train yourself and train others, in spite of it, I would like to do in yourself. When we want to do in yourself, we need to understand the counseling skills. What are the counseling skills and what is counseling is an important aspect. As you know, counseling is a two-way process. Not it is a one-way process. It is a two-way process in which, both client and counselor must come together, and counselor is a person who understands the problem of the client, and client is a person who is with problem. Therefore, the objective of the counseling, any type of counseling, is not only guidance, not only direction, but to make the client self-reliant, helping him to be reliant. So this is a very important challenge before us, before the counselors. So what to speak about on this occasion? The scope of counseling is various. You must be aware. Individual counseling is there, interpersonal counseling is there, family counseling, professional counseling, and we are talking about school counseling or educational counseling. Just I have told you something about counseling, but I'm taking back to you to understand counseling is an activity that takes place when someone who is troubled invites and allows another person to enter a particular kind of relationship with them. Richard, Nelson, and Jones, they are of the view that the client must acquire certain skills. The first skill is life skill, and second one, mind skills. Life skill is to be developed, and that mind skill, is therefore client is able to useful self-help. Mind skill helps to develop the self-help. Whereas the life skill in which the cooperation, the acquired values, communication, coordination, are important things. So these are different scopes. Something about counseling, everyone knows it. We are talking about school counseling, educational counseling. Educational counseling. What we need, what is education? All of you know, be knowing it. Something I would like to tell you, education is a form of learning in which the knowledge, the skills, and habits of group of people are transferred from one generation to the next through teaching, training, and research. Coming to the point, education is knowledge. Knowledge is very important. What do we mean by knowledge? Knowledge is familiarity with something, which can include certain facts, information, description, or skills acquired through existence. So I was talking about knowledge, not telling you something about what do we mean by knowledge, but taking to you to the point. Knowledge is of two types: declarative knowledge and procedural knowledge. Declarative knowledge deals with factual knowledge, whereas procedural knowledge deals with skill-oriented knowledge. So here, for example, when we are talking about school counseling or counselors, where we need a skill to be acquired. Unless and until we acquire a skill, we cannot impart the knowledge to the client perfectly. Therefore, an important skill-oriented knowledge must go with factual knowledge. Both declarative knowledge and procedural knowledge must go together. Then and then only counseling can be successful. So as far as school counseling concerns, certain skills are important, or in general counseling, skills are important. So school counseling, what it includes kindergarten to college level problems. Number of problems we are going to face. Which school is going to be selected? Which medium of instruction is to be adopted? Which medium of instruction is to be adopted? Not only these problems, but how much schooling distance should be at childhood? Where the school is to be located? These are certain problems. We have to think about all these questions when we are counseling to the students at school level. Not the education is important at school, but it is a place where socio-emotional skills is to be developing. Children are easily mixing with one another. They are developing their socialization process. Number of problems they are going to face. Some children have fearful, lonely, or they may underestimate themselves. Some students seems to be emotional. They seem to be oriented toward their family. And some don't know how to study. How to study is a different matter, but they don't know how to study. They need guidance and they need study skill training program. Skills are there: how to remember, how to memorize, how to underline, how to make note, how to prepare exam, how to develop questions in mind, how to read, how to write. These are different skills. Study is a different thing, study habit is a different thing, and study skills are different. And psychologists must be perfect in training of these study skills, and then only the student can learn better way. Some students are panic to their children. panic to that teacher. And some students are not able to develop their friendship with others when they are entering with the school. Students should not be a scapegoat of stress and tension, and students should not be a scapegoat of internal conflict. So these are the problems when we are talking about school counseling. We need to solve it perfectly. Educational counseling must be active at 3 stages. Counseling at primary level, counseling at secondary level, and counseling at college level. So what I was telling you, my friend, when you want to be a successful counselor at schooling level, you must be having a perfect knowledge. Then only you can counsel perfectly. You have to be oriented toward psychoanalytic perspective. You have to be oriented toward interpersonal perspective. You have to be oriented toward humanistic perspective. You have to be oriented toward existential perspective, gestalt perspective, behavioristic perspective, cognitive, and life skill are the perspectives in which you must have a mastery, and then you will be giving perfectly imparting the counseling process at school level.
Sir, some
Hello?
network issue there, it seems.
Hello. I think there is some technical problem. Thank you, Dr. Shinde, Professor Shinde, for your informative and enriching speech. Now, I request our specially invited Dr. Venkat Rao, President WCOP of Andhra Pradesh, to speak a few words. He has completed his BTech Civil Engineering from JNTU Kakinada and PhD from SVU Sri Venkateswara University Tirupati. He worked as Assistant Executive Engineering in Srikakulam and Vizianagaram districts, and at present he is working as Deputy Executive Engineer in Visakhapatnam district. I request you, sir, to please speak a few words.
Thank you, Dr. Chinni Simon, madam, for introducing me to the today's guests who attended this seminar. And I especially thank Dr. B.G. Reddy garu to give me an opportunity to work as a president of WCOP of AP Charter. And right from our joining into psychology course at SV University, we used to astonish about the work done by Dr. B.G. Reddy garu, and the same thing is being done at WCOP also. Almost at the age of 70, now he is conducting all these programs by coordinating various dignitaries, right from not only from AP and Telangana, from all over the country. And some international seminars also being conducted by Dr. B.G. Reddy garu. And I am conveying my thanks to Dr. B.G. Reddy garu, because this is one kind of service activity which is very much useful for the practicing counseling psychologists, as told by Dr. Shia garu and Dr. Shinde garu before me. And various aspects of counseling are to be dealt in this 3-month workshops. It is undoubtedly, we can say that it helps a lot for the practicing psychologists and teachers who are very much in intimacy with the children they are regularly interacting with. Generally, there is a saying that practice makes man perfect. See, when teachers are observing students and they are recording the practical problems they are encountering in facing the children and treating them. See, this is one kind of exchanging views, interacting with each other, and knowing so much things, practical solutions from the experts in the area of psychology, like Ganeshan sir, Girishwar sir, R.N. Singh sir. See, coordinating all these great people with the people who are working at field level is a very hectic task. And once again, I congratulate Dr. B.C. Reddy garu for doing this task and giving me opportunity to serve the organization in the capacity of state president. Thank you very much, ma'am.
Thank you very much, sir. Now I request another special invitee and today's trainer, Dr. Pankaj Singh. He has completed his PhD from Bharatiya University. With 16 years of meritorious service in Indian Army, he worked as assistant professor and head of the Department of Psychology and Sociology in Lovely Professional University, Punjab. Now he is working as assistant professor in Allied Institute of Psychology and Allied Sciences, Noida. Participated and organized many seminars and workshops and conferences, and published several papers and articles in various journals of national and international reputation. We are very happy to have you as our trainer, sir.
Thank you.
I request you now to continue with the program, and I request the participants to come up with your problems. Since we are running short of time, you please start to ask the problems immediately.
Thank you, ma'am, for giving me this opportunity. And I thank all the dignitaries who have invited me, considered me for this training. I really thank them. And with this, I would like to start with this school mental health training program. And see, our youth spend more time in school than they do anywhere else except their own home. And school is one of the best place for both educators and students to become increasingly aware of mental health. Mental health problems and mental disorders, if you see, they are increasing day by day. We have a number of school mental health initiatives in development and are constantly looking for teachers, schools, and school boards. And we have seen it that recently many school counselors are appointed to handle the school mental health. It is the intention that these resources will help to enhance mental health promotion, prevention, treatment, and referral, and will provide practical tools for improving school environments. For adolescents, it's well known that mental health issues such as anxiety, depression, family problems often are the root cause of poor academic performance, disciplinary issues, truancy. While many schools have social workers, counselors, but still there is a lot need to be done. And still, if you know, as per the recent newspaper articles, India is running short of mental health professionals. So we are not able to cater the requirement which is there in the society. So that is why budding school psychologists and counselors need to come up and take this issue on priority. So why we need to look after mental health in schools? The variety of psychosocial and health problems affect learning and performance in profound ways, as we know. Such problems are exacerbated as youngsters internalize the debilitating effects of performing poorly at school. So either they internalize or they externalize their problems and are punished for misbehavior. That is a common correlate of school failure. School-based and school-linked programs have been developed for purposes of early intervention, crisis intervention, prevention, treatment, and promotion of positive social and emotional development. So, specific responsibilities which a school counselor takes up are individual counseling, consultation, student appraisal, parents' help, referrals if any case is not manageable by the school counselor, career development, change agent for school atmosphere, student advocate in meeting with teachers and staff, classroom observations on behaviors, relationships, and providing feedback to teachers, students, and parent staff. Even school counselor is involved in public relations, local research, screen students for interview for new students, and staff development, taking workshop for teachers also. So if we see what are the common school problems which comes usually, the most important problem faced by counselors in dealing with different children in school is lack of knowledge about different disorders, because people are not aware of disorders. Their parents are also not aware, and then they punish the children and then they exacerbate the situation. Lack of acceptance and attitude shown towards any disorder, because as soon as any disorder is seen in children, they are rejected in the school. There is no room present in most of the school for the counselors. So this is also a hardcore reality. The attitude of the staff members is not appropriate towards the counselor in some schools. So they don't take it seriously. Rather, some school counselors are given teaching jobs. So that is, these are some ground realities which are happening in schools. Counselors not able to form rapport with child during the sessions. When the counselor makes the time to counsel the students, they find themselves discouraged because they only have limited time to give to the students. Why school counselors feel that they cannot deliver the help they were trained to give? The answer is practicing school counselors commonly cite the lack of training in counseling strategies. So if they are experts, then obviously they will be respected and they will be also taken seriously by the students as well as the staff. The problem faced by the counselor is that other staff members feel insecure and think that the counselor is trying to take their place. Some teachers feel that they are better than counselors. Some counselors find difficulty in adjusting with teachers. There is a pressure from principal and staff members to bring about change in the school. Parents' attitude towards the counselor is also negative. They feel that counselor deliberately focusing on their child and punishing them, and salaries of the counselors. So these are the ground realities which are happening in school. Common school issues, what we can see is are basically all the techniques should be on tips basically. The counselor should be well acquainted with the techniques which are required for counseling and to treat the children as per their issues. They need to be expressive, and counselors should have special training so that they should be aware of the disorders. They should be aware of the criteria. They should be aware of the techniques or treatment plan, and they should be adept in their assessment part also. Counselor must have an idea of their own identity, both personally, professionally. Counselor should work towards the best interest of children. Before starting the job as a counselor must be clear with their concepts regarding making awareness to the parents. Psychoeducation need to be given to the parents. So for that also they need to be well adept with it. The biggest drawback is the thinking of the teachers who feel that they can counsel every child of the school. So if you give psychoeducation to the teachers also, they will come to know that counseling is somewhat different from normal talking. So what are the common childhood problems or disorders which are usually you will find as a counselor? See, one is intelligence. So if intelligence is low, they won't be able to sustain in the school with the other students. So that is why we need to assess their intelligence level. We can use some tools like Raven's progressive matrix to test their intelligence level. We need to also see whether the children is suffering from any learning disability. It might be dyscalculia, inability to calculate, dysgraphia, an inability to write, or it is dyslexia, inability to read. So these things also we need to identify. Also, along with it, we need to see if any anxieties are associated with students. For example, mathematical anxiety, or maybe speaking anxiety, which we call it as glossophobia, public speaking anxiety, or maybe any phobia a child is suffering from. We need to look after, we need to identify those phobias, and we need to uh, try to remove those phobias. Children might have also disorders like ADHD, attention deficit hyperactivity disorder. So we can't just label them that they are naughty, or they are not following the rules, or they are not they are disobedient. No, we need to see the causes behind their behavior. Like it might be ADHD, that is why the child is not able to focus in the class, and also not able to sit quietly in the class, and is not able to maintain the decorum because of this school class decorum, because of this disorder. It might be oppositional defiant disorder. If suppose any four symptoms, like loses temper, often argues with adult, often actively defies or refuses to comply with adults, often deliberately annoys people. Anything you want to say? Any question? Okay. So your question is not clear. Come again, please.
Hello.
Hello.
Yeah, Pankaj.
Yes, sir.
Dr. Pankaj, you just allow the participants to raise questions.
Okay, fine.
Yeah, please.
Sir, good evening, sir. I have a question, sir. A student who is studying 5th class is suffering with nightmares, sir. The parents complained that he is suffering with nightmares.
Mhm.
Yes, sir. And he feels uneasy on the next day after getting up. And what are the counseling remedies you suggest me, sir?
Okay, fine. So see, nightmare. First of all, we need to understand what is nightmare, and when it happens. So if you know the stages of sleep, we have non-REM and REM stages, right? Non-REM is a stage where we are not dreaming, right?
Rapid eye
REM,
movement.
sorry.
Rapid eye movement.
Yeah, rapid eye movement. So rapid eye movement is a stage where a person dream, and nightmares happen in REM stage only, when a person is dreaming, right? So how you can identify first? uh, First of all, a person should have vivid dreams which are very scary, and once they get up from their dreams, they will be sweating, they will be having their high heart rate, respiration rate, and their muscle will be toned up, and uh, they will be in distress, lot of distress. And why, when we will consider it as an issue, when it occurs frequently, and if it is a major distress, it causes immense anxiety. It affects your concentration or memory. Or if suppose it is not allowing you to sleep because of that fear, and the causes behind is stress or anxiety, stress, anxiety happening in day-to-day life, or maybe depression, or sleep deprivation, or any trauma happened in the childhood, or other disorders. So these are some issues uh, or causes of this nightmares. So what we can do is we need to see what is the cause behind a nightmare. So if it is stress or anxiety, right? If suppose a person's arousal level is very high, we need to measure the arousal level by using certain tools like iPad anxiety tool or other tools, where we can see whether the person's arousal level is high or not. If the anxiety level is high, then we need to first handle uh, the physiological symptoms. So first we need to give certain treatments like JPMR, Jacobson Progressive Muscle Relaxation. and rate of reduction of breathing techniques. So there is one diaphragmatic breathing. So usually people breathe from clavicle or chest breathing, which is not allowing the diaphragm to move up and down, and thus is not able to trigger the vagus nerve, which is passing through the diaphragm. And the vagus nerve, ultimately, once it is triggered, it activates the parasympathetic nervous system. So just by deep breathing and by practicing Jacobson progressive muscle relaxation, you will find that the arousal level or the anxiety level will go down. The physiological arousal will be controlled, because after that only you can give any intervention with, and it will prove effective also. One of the technique is developed by our respected professor Vedgiris Ganeshan sir, and he has developed rate of reduction of breathing technique, right? It you can also use it. It is mentioned in my research papers also, which I have published. So this technique also helps their rate of reduction, that is the breathing rate. It slows down the breathing rate. So front line of treatment will be the reducing the physiological arousal. Second will be, we need to see what is the cause behind it. For example, if it is a trauma, then we can go for acceptance and commitment therapy. Acceptance and commitment therapy is very effective, if you know, because it has proven effective for trauma also. So if any trauma happened in the life of a child or of a person, we need to take history, and from history taking we will come to know when it happened, how it happened, what was the situation exactly. And the good thing about acceptance and commitment therapy in this case is, here the child should not fight with the anxiety or the trauma or the images which are troubling him. Rather, in acceptance and commitment therapy, they will be, first of all, making a distance from the image, because image creates problem, right? We think in images. So once the image comes, it activates our amygdala in the brain, and then fear related information comes, and our sympathetic nervous system gets activated. So what we need to do is, rather than fighting with these images, with this anxieties, we need to be aware of that first of all, and we need to make a distance between those images through cognitive diffusion. For example, rather than saying that I'm a loser or I'm scared, I can say that I have a thought that I'm scared. By this, we have made a distance between my thought and myself. This is called as cognitive diffusion. We can then go for acceptance. Once the anxiety comes, once the thought or the images comes, rather than fighting with them, we need to take deep breaths and be aware of the impact of those thoughts. Rather than processing those thoughts, we need to see how these thoughts, images are impacting us on the body. For example, there is a burning in my chest, there is a tightness in my chest, there are butterflies in my belly, or there is a tightness, tightening of my shoulder muscles happening, or I am sweating now. Just observe the physiological changes happening rather than the thought or the image. Once you focus on that and be just aware of that, automatically the anxiety will reduce. Why? Because we will not be processing the thoughts or the images, which are the root cause. So gradually, if we just focus on the physiological symptoms, what will happen? The hormones which are released during this time will get diluted, and no more new hormones will be released. Then we also need to be aware that we are just observing the thought, and we are not the thought. We are the observer, and thought is to be observed. This is called as observing the self. So the individual need to practice this, and after that they need to find what are their values and commitments which they want to perform. If this child is troubled with this nightmares, they need to see what they exactly want to do in their life. So the values they need to note down and the actions which they need to perform. And whenever they are performing their actions, they need to be just aware of that anxiety. Whenever the anxiety comes while performing those tasks, they need to be just aware of that and practice mindfulness. And rather than fighting with the anxiety or the image, we need to, or that person need to be aware of the impact which it is causing on the body, that is the physiology. So just be mindful of the changes happening in the physiology. If this a person can practice, then the person can control this anxiety and gradually it will lose its intensity. So acceptance and commitment therapy we can practice. We can practice CBT. If suppose there is a belief, right? Belief. If the belief of a person is wrong or irrational, then we can work on the belief. We can identify the belief through CBT by using downward arrow technique. And we can find the intermediate beliefs, the core beliefs, the automatic negative thoughts. And once we find the core beliefs and intermediate beliefs, we can use numerous techniques which are mentioned in CBT as per the requirement. Even if a person is having childhood memories which are troubling him and causing stress and anxiety, we can use early restructuring techniques which are mentioned in CBT, or we can change the imagery of a child by using numerous techniques mentioned in the CBT. So we can use many techniques in that case. Even person-centered therapy is very effective in this case.
Thank you so much, sir. Thank you for clarifying my doubt.
Thank you. Any other question?
Good evening, sir.
Good
This
evening,
is Madevi.
Yeah, good evening.
So this is about the most mothers or parents have the concern regarding the memory of their child, because
Okay.
often the children say that we are reading everything, especially for 9th and 10th classes. So we are reading a lot, but we are forgetting and unable to produce in the on the answer sheet. So how to improve their memory, or what are the causes for losing it? I mean, not able to memorize it, because
Yes.
most of the schools they say that you cannot write on your own, but you have to produce whatever he has given in the notebook. So where the problem lies? So because most of the children, they just can't mug up and write it on what exactly is given in the notebook. So those children who can do it, they're scoring, but the children who are not able to mug up and produce the answer, they are losing the marks, and which is causing them anxiety in them. So how can they improve their memory?
Yeah, thank you. Thank you for asking this question. See, basically, and it's a very good question, very relevant question in school. See what happens if you study the physiology of the brain. You will find that there is a working memory, right? Working memory is a very important part of our memory. And if a child is anxious, right? If a child is anxious, if a child is having automatic negative thoughts, the child's working memory will be consumed.
Okay.
So, and also once they will be forming the, once they are learning, this anxiety or these automatic negative thoughts will not allow the child to focus on the content. Rather, they will be daydreaming much because of the stress and anxieties, and they will not be able to imagine what they are learning. So basically what the child need to do is, first of all, they need to imagine what they are reading, because we think in images. If we are just reading and not creating an image of that, then the child will not be able to store that information effectively, right? And we need to distribute the learning. It should not be mass learning, that we are learning for 4 hours. We need to give breaks in between. And as you know, Herman Ebbinghaus has done research on this, and he has proposed that the best thing is if you revise the concept within 20 minutes, or if not, at least same day, the concept need to be revised, so that it will go in the long-term memory, right? Otherwise, it will be the long-term potentiation will not happen in the brain, and the weak synapses will be pruned away after a certain period of time, and because of this, long-term depression will happen, and a person will not be able to retrieve those information, right? So first of all, we need to look after whether what is the cause behind memory, whether it is stress anxiety. If it is stress anxiety, we need to look for the techniques which we have discussed, right? We need to go for that, because if we will not treat the root cause, memory will not improve, right? Secondly, we need to go for some mnemonic techniques, mnemonic devices, as we know, right? If suppose a list of sentences a person need to remember, right, in a sequence. So a person can go for peg word system, peg word system. For example, one is bun. So the person can imagine that first statement, open the bun and imagine very uncommon image, because if the image will not match with your schemas, then it will be stored more in your memory, right? So imagine an awkward image, or I would say very uncommon image. One is bun. You open the bun and the first topic what you want to learn, imagine in that. 2 is shoe, 3 is tree, 4 is door. So you are opening the door and whom you are looking. 5 is beehive. So there is a beehive, now attach your fifth point with it and imagine a awkward or uncommon situation. So once you do that, you will be able to remember these things in a sequence, right? So we can use many techniques like categorical clustering, or we can use interactive images, or we can use method of loci, right? For example, 5 things we need to remember. So ask the child to imagine that the child is going from one room to the another room, and in one room he has kept the first topic. Then he went to the second room, he has kept the second topic, third topic, fourth topic. In a sequence he is going. So by this they will remember and change the color of those sentences, or maybe create an image of that particular sentence. What image is coming while reading that sentence, so that the child will remember what exactly he need to write. Or acronyms can be used, acronyms. So there are so many techniques which a child can use in that case. And the good thing is they need to be, I recommend personally that the child need to practice mindfulness and meditation. Because if you see MBCT, ACT, even this CBT is now focusing on mindfulness, because most of the time is wasted by a child during daydreaming. So if a child practice mindfulness, then they will not be daydreaming, they will not be their thoughts will not be wandering. So they will spend much time in reading and imagining. And also they can write in their own words. Whatever they are reading, they need to write it in their own words rather than mugging the sentence as it is. So those things, if a child practice, right, even they can see any video on in YouTube of that particular concept, so that they are creating images of that particular concept. So these are some techniques which we can suggest to children.
Okay, sir. Thank you.
Thank you.
Sir, good evening, sir.
Good evening.
This is Divyamani, sir.
Good evening.
Sir, how to deal with students with suicidal thoughts? Sir?
Mhm.
Many children, they think of committing suicides,
Mhm.
and some even commit. How to prevent those in adults and children?
Mhm.
10 plus 1 and plus 2 due to failures, or sometimes when parents scold them or compare them, they attempt suicides.
Mhm.
How to prevent the thoughts, first of all, sir?
See, basically, as we have discussed earlier also, we need to look for the causes behind every problem, right? We can't generalize the problem for every student or every person. So there are relationship issues, right? There are maybe failures happening in academics. There are maybe grief. Grief has not happened. Uh, the person is suffering from some grief, loss, major loss, or rejection. They might be suffering from rejection or sexual abuse. So we need to find out, or it can be even unemployment. So we need to find out what is the cause behind the problem first of all. And then we need to see whether this thought is basically dangerous or not. Because if there is a suicidal ideation, and if the person has decided the date, the way with which the person will be committing suicide, and he is very sure about the details, and the worst thing is, if suppose he has committed suicide in the past also, then it can be a dangerous sign. So we need to immediately inform the, and we have to make a contract before doing counseling, that whenever you will be going to threaten yourself or harm yourself or the society, then I have a full authority to breach the confidentiality. So you can contract in advance, and then you need to inform the parents or the school wherever is the student, so that they can take necessary steps. So what is the reason behind, for example, let us take relationship issues. What happened in that case is, the individual once get into a relationship, they make the other person significant other. They think that the other person is the only entity existing. They give whole power to them, right? So once they reject them, they feel a global rejection, and that is why they feel worthless. And worthless, lack of self-esteem are the main cause of maybe committing suicide, right? So we need to, for example, if this is the case, so here what we need to do, we need to work on the self-worth of that individual. So we can use strength bombardment technique, right? We can use we can invite the individual to interact with, we can use behavior modification to make the individual to interact with many people around them in their circle, so that whenever they are interacting with others, what will happen, they may form more support group, social support group, and in this due course they may form new relationships also. So by this they will get a support, and once you work on their self-esteem, you can use person-centered therapy, where you give unconditional positive regard, you show empathy towards the individual, and if you do this, what happens is the person's self-worth increases. So these are some suggestions which you can use for these people who are having suicidal thoughts. Even if it is an automatic thought coming again and again, you can help the person to use distraction techniques. For example, thought stoppage technique. Thought stoppage technique can be used to distract from these thoughts. Or my guide, Professor Vedgiri Ganeshan sir, has told that if a thought is troubling you, what you can do is you control the thought, right? You can repeat those thoughts which are coming in your mind, and change the voice tone also. Like, first you can repeat the thought in the voice of a female or a child or an adult or a cartoon. So once you do this, the automatic thoughts which are troubling you, they will stop. So you can distract the thoughts also. I mean to say, you can help the individual to use these distraction techniques also. And the important thing is, initially when this thing is happening, we need to inform the family members to remain with the individual and give social support, right? He should not be left alone. So because these are some very important things to be practiced. So these things we can do.
Good evening, sir.
Good evening.
I'm Sharina. I'm a government high school teacher, sir. So today I would like to ask you a case about a 9 years old boy. He's very stubborn and extremely aggressive at home. He tends to hit his parents also, sir, sometimes, and lies down on the floor and cries till his demands are met. So how to control of his anger? Please suggest some solutions.
See, as you told me that the child is lying on the floor and crying when once his needs are not met.
Yes,
Is that
sir.
what you have mentioned now? Now we
Yes,
need
sir.
to
He is very aggressive,
very
very
aggressive.
angry. Yes, sir.
See, children are called as little professors. Okay. What they do is they learn very quickly. So in that case, what you have mentioned, the child has learned that if I ask the things politely, my needs will not be met. Because in the past, when the child has tried, the parents have denied it because all needs are not met, not supposed to be met. So what this child has learned is maybe the child has cried because of this when refusal uh, has come from the parents. So the child has learned that if I cry, after crying, maybe because of the refusal, when the child cried, the parents might have given the reward, whatever he is looking for. It might be attention, it might be anything which the child is craving for. And then the child learns, if I show tantrums, my needs will be met. If I ask politely, my needs will not be met. So his undesired behavior is reinforced positively. Whereas parents, uh, their behavior of giving those things which the child is craving for has increased because of negative reinforcement, because they are evading those awkward situations or negative aversive situations. So to avoid that, they are giving the stimulus or the reward, whatever the child is looking for. So here we need to look for the cause behind this. And if the cause is attention, we can use extinction. We need to ignore that behavior whenever the child is uh, showing that aggressive behavior or undesired behavior. We need to ignore it. If the child is looking for some other rewards, then also we need to use extinction here. We need to remove the cause of that particular behavior. What is reinforcing? It might be attention, it might be some other cause also. We need to look for the cause and we need to remove that cause. At the same time, uh, we need to uh, reinforce an alternative desired response. For example, asking politely. This is called as functional communication. So we can train the child in functional communication, asking very politely. And then what we can do is, if the child asks politely, we need to give the reward continuously. First, we need to practice continuous reinforcement. And once the child learns it, we can use partial reinforcement, right? Sometimes we'll give it, sometimes we'll not give it. And this is also called as fading. We will gradually fade away the reinforcements. Earlier we will be giving alternatively, then we will skip 2 times, then 3 times, or in a out of 5 requests we'll only fulfill 1, and rest we will fulfill with social praise. And gradually we'll shift to social praise only, acceptance and social praise. So by this we can change the behavior of a child. And if the aggression is not controllable still, then we can give a vent to these aggressive activities. For example, we can use catharsis. Some punching bags need to be given to punch the bag, or also we can engage the child in aggressive sports activities like football or badminton or basketball, into some constructive activities, swimming, where he can vent out his energy. Also, there is one technique called anger reversal technique, which respected Professor Dr. Vedvigiri Ganeshan sir has made. This technique, you can use it in which the child will be allowed to sit on a chair and a mirror will be kept in front of it, and the child will be asked to call his name and then say that, suppose I am the child, I'll say, Pankaj, get angry. So I'll see in the mirror myself and I'll be becoming angry. I'll show all the signs, for example, clench my uh, teeth, make a fist. Am I audible now?
Yes, sir.
So then once the child is angry, then he need to say to oneself that now Pankaj, calm down. And then again notice in the mirror how he is calming down. This he has to repeat 4-5 times, twice a day. So the child will learn how to relax and how to become angry. So that anger will be in control of the child. So these techniques can be practiced to control anger also.
Thank you, sir.
Dr. Pankaj. Hello.
Yes,
Dr.
sir.
Yeah, it is already time.
Yes, sir.
We will continue in next coming sessions
Right, sir.
as your turn comes. Now, I request Dr. Ramadevi kindly propose vote of thanks. Dr. Ramadevi, unmute yourself.
Good evening, everyone. It's a great opportunity to learn again on this platform about the school psychology and the attitudes or the behaviors of the children, those who are facing in the schools, either in the homes or the schools, or complaints received by the teachers. So I would like to show my gratitude to the special invitees, Dr. Pankaj and other invitees, those who have been giving us valuable advices and valuable inspiring words to motivate ourselves and to move forward with more experiences and more knowledge. So I would like to thank all the participants and especially Professor B.G. Reddy Garu and Chinni Simon Ashok sir, so who has given setting up the platform to learn and sharpen our skills. Thank you everyone and have a good evening.
Thank you all. Good night. See you in the next session.
Thank you, sir.
Thank you, sir. Thank you, sir.